Hey everyone, if you're getting ready for the NCLEX, or honestly just trying to sharpen your skills for the floor, you are in exactly the right place. Today, we're going to tackle one of the absolute biggest skills for any RN, delegation. We're going to get specific and talk about how to safely and effectively delegate to your licensed practical nurse. And listen, this isn't just about passing a test. This is about patient safety, teamwork, and being a leader. Okay, let's get into it.
So here's our game plan. First, we'll figure out who's on the team, what exactly is an LPN. Then we'll hit the #1 rule of RN responsibility. After that, we'll get into the nitty-gritty, the can-do and cannot-do list for LPNs. From there, we'll build a framework so you can make the right call every time. And we'll wrap it all up with some NCLEX gold and a final judgment call. Sound good? Let's go.
All right, first things first. You really can't lead your team if you don't know your players, right? So understanding the LPN's role, that is the absolute bedrock of delegating safely.
Okay, let's break this down. There are two phrases here that are just everything. First, licensed nurse. That's huge. It's what separates an LPN from, say, a UAP. But the second part, under the supervision of an RN, well, that defines the entire relationship. That right there sets the stage for everything else we're about to cover.
So let's put them side by side. The LPN, they're licensed, but their scope is a bit more focused. Their sweet spot is the ongoing care for stable patients. Now, the RN, that's you have the broader scope. You're responsible for the whole care plan, especially when you're dealing with patients who are complex, unstable, or brand new. This whole idea of stability, we're going to come back to that again and again. It's the key. So, building on that, let's move to the next piece of the puzzle. And this part, it's completely non-negotiable. Not on the NCLEX and definitely not on the floor. This is the absolute core principle of delegation. And here it is. This is pure exam gold, so really let this sink in. You can delegate a task, but you can never, ever delegate your accountability. When it comes down to it, that patient's outcome is your responsibility. It's your license on the line with every single task you hand off. I love this quote because it just says it all, doesn't it? The NCLEX loves to try and trip you up on this. They'll give you a scenario where a task was delegated, something goes wrong, and then they'll ask, who's responsible? And the answer is always the RN. See, delegating is about using your team's skills. It is not about washing your hands of a task.
So what does that accountability actually look like in practice? Well, it means you, the RN, perform that initial head-to-toe assessment. It means you decide which tasks are even appropriate to delegate in the first place. Then you have to supervise the LPN's work. And, this is the part people forget, you have to circle back and evaluate the patient's outcome. Did the task get done right, and did it have the effect we want? Okay, we've got the big picture legal stuff down. Now let's get practical. What can you actually hand off to your LPN? And the key word, as always, is patient stability.
For a stable patient with a predictable outcome, LPNs are absolute rock stars. They can do focused assessments, like listening to lung sounds on a stable COPD patient whose baseline we already know. They can monitor, collect data like vitals and blood sugar, and they can do routine procedures they're trained for. Now look closely at that phrase, reinforced teaching. They can go over information you've already taught, but they can't do the initial teaching. And yeah, they can give routine meds. This is their zone, managing the expected.
Now, just as important as knowing what you can delegate is knowing what you absolutely cannot. These are the red flags. These are the tasks that demand the advanced clinical judgment that only an RN has. This slide is so important. LPNs absolutely cannot do that initial admission assessment. They don't create or change the nursing care plan. Any task that needs complex judgment, like triaging or figuring out a brand new problem, that's all you. No initial teaching. And for the NCLEX, just assume that LPNs do not give IV push meds, blood products, or chemotherapy. Those high-risk things stay with the RN.
And here it is. If you only remember one thing from our time together, let it be this. Burn this into your brain. Is the patient new to the floor? Is their condition changing on you? Is the outcome of this task kind of uncertain? If you answer yes to any of those, the decision's made. The task belongs to the RN. End of story. So we've got these lists of do's and don'ts, but let's be real, nursing isn't a simple checklist. It's messy, it's dynamic. So now, let's build the mental model you need to make the right call every single time, in any situation. This is a classic, but it's a classic for a reason. It works. Before you delegate anything, you should be able to mentally run through this list. Is this the right task for an LPN? Is it the right circumstance? Is my patient stable? Is this the right person? Is this specific LPN competent to do it? Did I use the right communication and give clear instructions? And am I providing the right supervision? You need 5 yeses. Let's just hammer this point home one more time, because it is the #1 decision point. A patient with a chronic, stable condition like COPD who's just in for a routine treatment, that's perfect for the LPN to manage. But that new admission, straight from the ER, or the patient whose blood pressure just tanked? Nope, that is 100% RN territory. The patient's stability dictates everything.
So let's turn this into a quick mental flowchart. A task comes up. The very first question you ask yourself is this: is the patient unstable, or is this a brand new problem that hasn't been assessed yet? If the answer is yes, stop. The task stays with you, the RN. Okay, so if the patient is stable, you can move to question 2. Does this task require complex clinical judgment? Think of it this way. Is it just about collecting data, or does it require analyzing that data to make a decision? Giving a scheduled antibiotic is a task. Figuring out why a patient is suddenly short of breath, that requires judgment, and that's the difference. All right, let's pull all these threads together. This last section is where we're going to synthesize everything we've talked about into a powerful study tool and then test your understanding, just like the next-gen NCLEX will.
This chart, this is your new best friend. Seriously, it lays out the whole hierarchy of care so clearly. Notice the RN can do everything. The LPN has that really solid role in the middle, focused assessments, oral meds, and the UAP is absolutely vital for those activities of daily living. You'll want to study this chart to really see how all the pieces fit together.
Okay, here's a rapid-fire review. These are the must-knows for your exam. Ready? LPNs, licensed but limited. They do no initial assessment or teaching. They take stable patients only. Reinforcing is not teaching. The RN is always accountable. And the big one, if it's new, complex, or unstable, it's your task as the RN. You know, sometimes a simple little phrase can help lock in a concept, so here are a few memory anchors for you. RN assesses, LPN progresses. That means you do the initial assessment, they monitor the progress. LPN reinforces, RN teaches. Predictable equals LPN, and my favorite, if it's new, it's for the RN to do. Use these to help you out. Okay, let's do a real-world scenario, just like you're going to see on the NG-N. So picture this, you're the RN. You've got a patient with stable COPD who is due for their scheduled oral antibiotic. At that exact same moment, the ER is calling with report on a brand new admission with active chest pain, and your LPN is right there ready to help. So, what's the move? Think about everything we've covered: stability, scope, your accountability. Who is your absolute priority right now, and what task, if any, can you safely delegate to your LPN? Think it through. That right there is clinical judgment, and that's what makes you a great nurse.